Hi, everyone. I am just really thankful that you are here for our webinar and our conversation today on why your local health department needs an AI policy. So let's sort of start our conversation today with providing a roadmap of where we're going. So we want to start with talking about the current use of AIs within local health departments. We then want to give an overview about AI. We're then going to talk about the need for an AI policy. We're going to talk about the F&T Labs approach. And then finally, we're going to end with an open discussion. So most of you have probably been on a Teams webinar in the past, but I just want to give a quick overview of that. And that's because at Flourish and Thrive Labs, one of the things that we really, really value is being people first and valuing connection and conversation. So unlike most webinars in which it's going to be mic off for everyone and there's really going to be no real interaction, one thing that we value is actually having a conversation with us and with you during this space to make sure that you're getting the most value out of your time. So just a few things that you're presumably sort of aware of within the team's environment. So the first is that you can click up at the top of the screen to be able to get to the chat. We welcome you to either ask questions there as the webinar goes, if you have any questions. Also, just if you want to introduce yourself, say where you're from, that would be great. The next thing is just at a few points throughout the webinar, we're going to launch polls as a way to gauge and get feedback from you. And so those are just going to pop up on the screen. So you can click there, click submit, and then we'll have your information. And then the final thing here is that we invite you to come off mic if you want to be able to ask questions as opposed to having to type them out, if that is what's easier for you. If you have any questions, feel free to type them in the chat. We're going to be monitoring that, but we want to give you the ability to ask those questions and use your voice. And at the end, we're gonna invite, if you want to come off camera, have a conversation, put that mic on, and then we can really converse there. So want to give you an overview of who your speakers are today. So my name is Juliana McMillan-Wilhoit, and I am the president and COO of Flourish and Thrive Labs, and I'm really honored and excited to chat with you today. Flourish and Thrive Labs is a consulting firm that focuses on serving public health departments at the local, state, and federal level, and we are what I call technologists with a heart, where we believe in implementing technology, but we really care about the people behind it. I'm joined today by our CRO from Flourish and Thrive Labs, Nebu Kolancherry, and I'm also really, really thankful that Kim Moore, an application specialist from the Ottawa County Department of Public Health, is here to talk a little bit more about the process of working with F&T Labs on the creation of an AI policy, but why they decided that that was something that was so important. So AI is something that you probably know something about, and there was something intriguing about AI, which is why you decided to sign up for a webinar today. But AI is something that in the NACCHO Public Health Informatics Profile from last year, 7% of health departments said that they are using AI or they plan to use AI within the next year. That's actually a pretty small number. But 75% of county government workers in a NACCHO report said that they are using AI tools either at work or at home. So that means that there's a pretty big disconnect where an organization may not be planning on using AI, but employees are using AI probably for work tasks. Yeah, maybe they're using it to generate a recipe or to, write a silly Facebook post, but it's also very possible that your staff is going ahead and using AI to some degree on their work tasks. So we need to address this huge disparity between how organizations are viewing AI and how your employees are using it. So one just quick question that we wanted to have is just to start a quick poll here is your organization using AI? So sort of at an organizational level, or if you are aware of members of your team and your staff who are using AI. All right, so we're seeing it sort of as I'm looking at the responses, I'm seeing that in some of your organizations you are, and in some of them you're not using AI. And so what I want us to start thinking about as we get into this presentation is that if you're saying that your organization is not using AI, to start thinking about what are some of the ways that your staff may be using AI, but they aren't telling you about it. So if we go back to that report from NACCHO, 78% of local health departments perceived threats related to using AI. So there's this recognition that there's a real threat related to it, but most of them seem like their response is, we're just not going to use it, right? That's 7% compared to 78%. And nationally, if we look at the US, less than 10% of organizations have a policy related to the use of AI. So there's a disconnect, and we think that there's really a need to create a policy around how you use AI. So if you think back to the 1980s, 1990s, 2000s, when email became more ubiquitous, organizations put in place an email policy, right? Here's an example of one from the city of St. Louis, but there's an email policy there that guides the acceptable use of email, or about personal use of cell phones, right? Bring your own device policies. We create these policies around tools that we know that people are going to be using, and we've created those appropriate guardrails. And AI is one of those things that you really need to create those guardrails around. So let's chat quickly about what is AI. So there's a lot of different definitions of AI, and presumably most of you have some level of awareness. But if we just go back to what the Health and Human Services says that AI is, so artificial intelligence enables computer systems to perform tasks normally requiring human intelligence. For example, recognizing patterns, learning from experiences, drawing conclusions, and making predictions. So AI is a tool that leverages computer systems that can really be helpful in getting your work done. There's all sorts of ways that we see that this is being done in local health departments and in local government. So one way that this is done is with ChatGPT, which you probably have heard of, which is a chatbot type interface. There are other chatbots as well, such as Google Gemini, Anthropic's Claude. That's my favorite one. That's a topic of conversation for another time in terms of why I like it. But if you aren't familiar with it, what you can do is go on to a website and just sort of chat with it like it's a human being. Here I'm saying, hey, I work for a local health department. I need you to create Facebook posts around why you should get your flu vaccine. And then it's spouting out a few different Facebook posts for me. It's something that's really, really powerful. For me, I have a disability, and I find that AI is something that helps me do my work a lot better. It helps me with things like writing emails, checking the tone of my emails. It helps me come up with formulas every ding-dong day for writing my formulas in Excel. I am a better worker because I'm able to leverage AI to do my work. There's risks that we'll talk about in a minute. But also, AI isn't just these chat bots that you may have heard of. AI is increasingly becoming embedded within the tools that your team uses. So we'll talk about this in a minute, but there's now an AI that is in Adobe Acrobat Reader, the thing that you use to read PDFs. Microsoft Copilot, which is a tool that is embedded within the Microsoft suite, is an AI tool. Canva, if your team uses that for generating your social media content and community engagement, AI is present and used within all of those. And so that's where AI is embedded within a tool. And so as you think about AI is not just ChatGPT. AI is increasingly becoming part of the package of the software that your organization uses. But what we're also finding is that AI can be super, super useful for local health departments. So this is an example of a tool that we built at F&T Labs that takes a handwritten health permit application and takes that handwritten, not super easy to read, and it reads that handwriting and then outputs it in a format that can then easily go into your database, saving an organization so much time in that processing. There's still a human in the loop to make sure that that the AI is transcribing everything correctly, but it has such capability to really help speed up a process and make sure that you're able to process these things more quickly and potentially be a whole lot more accurate, right? Reading those John Smiths, those understanding sort of what the name is, what the phone number is, an AI can actually do that incredibly well. And another example here that Nebu's going to talk about of something that we built.
Thanks, Juliana. Hi, folks. I'm Nebu. And so this is a use case that we built for a county in the Midwest where I don't know if any of you all have worked with ECR data, but it's communicable disease data straight from hospitals that comes in to a public health agency. The data model is massive. It's really difficult to parse out the data to create cases. And so what I've been working on this for a long time and never found a tool that works, but some of these AI tools can read that. So Juliana, if you wouldn't mind playing the video, all right, so what this video is doing right now is taking a real de-identified ECR and processing it. And imagine like a world where instead of a fax coming in for a communicable disease, you get an email that says, here's the case, here's the things, and then it helps you walk yourself through the process where it offers suggested questions, it offers things, it reads and can fill in the gaps, as well as create the case in your surveillance system. That's the kind of power that this stuff has. And then toward the end, what you're seeing right now is we gave it the case investigation form from the state, and it outputs as a JSON, which you can then convert to a PDF. So even if your state wants, if you're local and your state wants it in a form, it can do that too. So this stuff is really cool, and we're really just scratching the surface. Back to you, Juliana.
So Sean, great question. Going back to the example that we of the health processing form. So in that example, when we talk about human in the loop, we think that it's always important for AI systems, particularly in health, that we're not taking away a person to actually review an output at this point in time. So we have built it so there's a flagging of like, hey, like this John, we're not sure if this is John Smith or Jane Smith or, Nebu colon Sherry or Nebu colon Very or whatever that example would be. So you can build that flagging in. But we think, for these systems, it's always important to have a human look over the information and make sure that, hey, this is right before, being loaded in. But if you just think about all the time that's saved of having to type in, transcribe, that's that example. So every day there are new use cases for AI in local government. So, there's being able to predict where unhoused folks are going to be living, that there's handling 911 calls, or, there's just all of these examples. And so what our goal is from this sort of first part of the presentation is for you to understand and see how powerful AI is for your organization, and that we want to encourage you to use AI. AI can really help with some of the all of the challenges that you have and make you do your work so much better. So we're begging you to not create an AI policy that says no AI at all, because we think that you are really shutting yourself down from so many wonderful opportunities. And also your staff may go around you and use it anyway. So one thing that we would love to hear, if you want to unmute yourself or just type in the chat, are what are some of the areas where your organization is leveraging AI? Transcribing meetings, one of my favorite uses of AI, of being able to have that transcript, and then I create really great meeting notes and action plans based off of those transcriptions. That's a really, really great use of it. One where you need to make sure that you get folks' consent to make sure that they agree to it, and that's a really great use. Oh, okay. And another example here is qualitative data analysis for community conversations and informing local community, and using it for informing your local community for your community health assessment. Those are really great uses, in ways that can presumably really help your work and help accelerate progress. So the next thing that we want to talk about are what are some of the dangers around the use of AI and not having an AI policy. So another example here that somebody put in the chat is pulling out relevant themes from large documents. Great, another amazing use of AI to really help you do your work. And as we like to say, AI is not necessarily artificial intelligence, it's an augmented intelligence to help push you forward in the work that you do. So there are lots and lots of challenges of AI, right? We've talked about the benefits. So two challenges that come to mind are an unauthorized disclosure of PHI and PII, as well as compounding bias. So perhaps in your organization, you have the process where if you send an email and it contains 9 digits, i.e. a social security number, it gets flagged either by your email system or it gets put in a bucket somewhere where somebody has to release it. Not all organizations have that, but some do, right? Because we recognize the huge challenges of accidentally leaking PHI and PII. And so here's an example where I'm going to Claude, with one of these chatbots, I'm saying, hey, here's some information on people, and I want you to do a little bit of analysis on this spreadsheet of people. Well, there was PHI. Of course, this was fake synthetic data, but that could constitute a breach where I'm just going about thinking that I'm doing my work well, but I've accidentally uploaded it to an external system, and that constitutes a breach, and then you are at significant risk. Another example is Adobe now has an AI tool that is embedded within Adobe Acrobat or Adobe Reader, whatever the tool is that you use to read PDFs. This is a paid feature, but they give you a number of free calls to it. And in this example, I have some clinic visit data, and this data ended up being uploaded to a large language model, and there was a potential for security breach. In particular, if you select a particular option with this that most people may not know to uncheck, Adobe actually is able to hold the data for 30 days, and then they're able to hold the data, and they're actually able to view and review the data that this person is uploading, but they don't realize that they're uploading it. They're just in a application on their computer. And so there's this immense risk for a data breach. And so this is where you need to really begin to think about what are the tools, what are the risks, the constraints, but also understanding the full landscape of what all ways is AI being integrated into tools, and which of those sort of comply with your security standards and which of them don't comply with your security standards. Because some of the embedded AIs may be okay for your and aligned with your particular security policy. So the next big challenge that I see around AI is around compounding bias. So the way that many large language models, so what ChatGPT, Claude are built on, is they are built off of a large wealth of knowledge on the internet. And so they essentially guess what the next word is based off of the context. So here it's going to guess that it's going to be the quick brown fox jumps because, that's the sentence that, all the fonts, it's everywhere on the internet. So these models are trained off of what they know, and we know that there's bias, particularly on the internet, around people groups, and so that's a risk that is present there. So if we look here at, I used an image generator to generate some images, and you can see here I gave it the prompt of generate a headshot of a local health officer for a local public health department. We can see here that there's a decent bit of bias in terms of what it thinks a health officer looks like, that there's sort of this assumption here in at least 3 of the 4 that it's a white man. And that is not necessarily the case of the demographics of what health officers are. Or here, I gave it the prompt of generate a headshot of a CEO. I thought that AI models were specifically trained to make sure that they included a woman in this now, but I did this last week, and we can see here, it's all men. There's, there's a particular bias here. There also seem to all be sort of urban and suit wearing, right? So there's this very particular picture of what a CEO is, which isn't necessarily how the world is. And we're not saying don't use these tools, but if you're generating images or however you may be using these tools, you need to really think about what is the bias that's present here. So now I want to hand it over to Nabu.
Thanks, Juliana. Hi, folks. So There's a question in the chat. I hope you can talk about how it is the IT departments who are the gatekeepers on whether a health department can use AI. This is often out of the control of the health department's leaders. Are there ways to approach IT department heads who are wary of privacy breaches and cybersecurity threats? Yes, absolutely. We've heard of multiple governments where the IT policies, no AI at all. And I think we've done this constantly. If many of your IT departments, I imagine, shut down COVID tools or tools during COVID that you wanted that would grossly accelerate your productivity, and we all managed to do that. And it's kind of like getting educated on. Um, Unfortunately, sometimes it's on us, which is not correct. The IT department should do it, I would think, but it's often on us as public health professionals to go do our research and bring a business case to your IT department on why X tool A is safe and B can increase productivity. Unfortunately, that's the best answer I have right now, Renee, but maybe toward the end of the presentation, we can have some open discussion with other folks that have been able to approach that in a better manner. So I'm Nebu. I'm the Chief Revenue Officer of Flourish and Thrive Labs. Prior to this, I was the Communicable Disease Chief in St. Louis County. So let's talk about what an AI policy is. And functionally, an AI policy is a guardrail for your organization. It's meant to protect your organizations against liability from any of the negative outcomes that can happen as a result of using AI. It's also meant to protect your staff and educate your staff so that if they choose to use these tools, they know how to use them well, and more importantly, communicate what your guardrails are for the use of that at work. And so an AI policy, again, helps protect your organization, but it also promotes fairness and consistency. So should your staff use this, we would advocate that you bake into your policy that you have an organizational policy for how your staff should evaluate the outputs of AI engines to minimize bias and promote fairness and consistency. The other thing it does is we're in public health. We do harm reduction. So we know that this exists out there. So AI policy makes the expectation for your team clear and defines what's acceptable and what's not, so that when push comes to shove, your staff know where the line is. And without an AI policy, but again, like to echo Juliana, you're risking a breach of PII or PHI data, violating HIPAA. And really, let's say none of your staff use it. I work with a lot of interns at undergraduate public health interns, and a lot of them use AI to write their papers. So it's kind of just part of their workflow. So if any of our interns, like, that's what kind of keeps me up at night is someone just going, oh, like, this is just part of this is how I write papers, this is how I write, and uploading things that they shouldn't be. And so having an AI policy in place helps protect you from all that and minimizes your liability. So kind of let's talk about what all should be part of your AI policy when you consider it. So there's three key areas that we would recommend. The first is the scope. So the scope is both the who and the what. So who does the policy apply to? Is it just full-time staff, part-time staff, like I said, interns? What about vendors and contractors? Should someone use an AI product that's a contractor? Is that allowed? What should their AI policy be? So the scope tries to answer those questions. The second is the what, and what really attempts to define what AI is. So AI can be something like a chatbot, which is where most people's mind goes to, but it can also be exposing your enterprise data to an LLM. It can also be other like machine learning applications where it can process and automate certain workflows. And including that in your AI policy helps your team know what they're dealing with, and more importantly, your leadership team aware of what the scope of this new tool is and where the boundaries are. The second big area is access. So the policy should govern access from a point of what the checkpoints are that people need to meet in order to have access to these tools. The first is your workforce has to have training, and we highly recommend some sort of a training to do that your workforce do some sort of a training before they're allowed to use tools. This is just like HIPAA. Everyone has to do those HIPAA refresher trainings. There are similarly a ton of AI training out there that gives your staff what AI is, how it works when they type a question into a chatbot or upload something into an AI engine, and getting that back. This would also answer how our staff are retrained. The second thing is access to tools. So is there a tool approval process? Are there certain tools that your IT or your IT lead should keep in mind that is able to be approved and not approved? How are you going to track that? And then do you want to define further, but like, your epi department can use blank, but the environmental team can't, or your clinic staff, can they use AI because they are, interacting with patient data in an EHR all the time. And then the last and probably most important part is the ethics and privacy bucket. So we're all concerned about data privacy and security. So the first obvious question needs to be, will you allow PHI to be entered into an AI tool? And then if yes, how is it going to be compliant with HIPAA? The other part of it is more like physical security as well. So in terms of like are you going to allow certain URLs in your organization or on your internet? Are there, apps that can or cannot be downloaded on your laptop, that kind of thing. The second thing is ethics. So that is more around like how you minimize bias. So how do you, like, you have to go into using AI knowing that it's going to be biased. So what is your staff to do? How do they evaluate it? Do they evaluate it? What ethical guidelines should they use when thinking through the output of an AI engine? And then finally, because of the policy should also include some kind of reporting and accountability mechanism. So how are you monitoring usage? What if how can people self-report or report an incident? If they have concerns, who do they go to? And demarcating that in a very clear way will help your staff use this better and use it well. And we highly recommend that, like, AI is not just ChatGPT. An email policy might seem ubiquitous to us because of the use cases are small. AI is actually quite complex and needs people with really ground expertise in this stuff, that has experience working with people. So we recommend that you use a guide. And also there's this danger of making it really simple. AI policy cannot just be yes, no, or maybe, because you can't, if you shut down everything, your staff are going to figure out a way around it. If you say yes to everything, that opens Pandora's box, and maybe it's just not clear enough. And the other part of this is like walking through a process, which we'll have Kim talk through in just a second. Having this conversation with your leadership team in a facilitated manner, we've seen is a good exercise so that they too can understand where the stuff is going. So we recommend that your guide have a significant understanding of AI's capabilities and risks. So ChatGPT is the tip of the iceberg. What else? Are you exposing your tools? Is Microsoft enabled AI for your organization? That kind of thing. And then that like you said, like Renee said, that complexity often goes far beyond most folks' IT department. The other thing is knowledge of how AI is being used and can be used in public health. So we work with health departments across the country and see both intentional and unintentional use of AI, and bringing some use cases to the table that I think really can help y'all see the potential of this stuff, both for good and for bad. And finally, our staff bring significant expertise in privacy and regulatory requirements. We have CISOs on our staff and a lot of certifications where we can help really tease out the nuances of what you should consider from a policy perspective when you are engaging with these tools. Next, I want to talk about our approach to this. So what we do first is we convene your team, and that can be your IT leadership team if you'd like. That can be your department's executive team. That can be your data modernization committee. So we'll convene that team and have a discussion really to assess the scope of what it is. We'll educate them on what AI is, how it can be used, and truly the magnitude of what those two letters really mean today, and then could mean in the next year or 5 years. Once we do that, then we have a series of proprietary questions that we'll walk you through to analyze those three buckets and answer the questions that you need for your organization that apply to you. Once we have that, then we can then take the output of those questions and draft an AI policy for you, and then refine that over the course of successive drafts with your team that we've convened and educated. And then finally, most health departments have either a policy review process through a board of health or a health officer, or maybe some sort of community advisory board. We can support that as well. All of us are former public health officials. We understand the minutia and time that it takes, and we will walk you through that step by step. So that's our process. The next thing I'd like to do is to invite Kim Moore from the Ottawa County Department of Public Health, hi Kim, we worked with her to build her AI policy. I'd love to for you to share your story.
Yeah, thanks Nabu for the opportunity to share today. Happy Friday, everyone. My name is Kim Moore, and I am the IT Application Specialist for Ottawa County Department of Public Health. here in beautiful Holland, Michigan. We are a local health department serving a population of just over 300,000 residents, and our department currently employs 113 public health champions. We were fortunate enough to be able to bring most of our executive leadership to NACHO 360 this year, and when we returned, two of the biggest takeaways for our group were that, one, we wanted to integrate more AI into our processes to improve the well-being of our staff, and then two, we needed an AI policy like yesterday. So we knew we had a handful of folks using paid subscriptions to AI models like ChatGPT, and we knew that inevitably there were team members who were using free versions of similar tools, or individuals we didn't know were using tools at all, but sure enough were. But we had no scaffolding or monitoring or training for any acceptable use of any of it. So some of the things that we know it's regularly being used for includes things like revising emails, summarizing meeting notes, transcribing meetings, writing SQL code and Excel formulas. I'm probably the most guilty of that one. Some data analysis, analyzing and rewriting surveys to improve the reading level, assisting and leading to a clinical diagnosis, lots of uses. And hearing those uses and knowing we had no guidance for staff was a little bit unnerving. We hadn't provided any training. We didn't know if staff understood what a learning model was or if they were verifying that the response that AI had provided was accurate. Some of those were pretty no or low risk queries, like getting assistance writing an Excel formula. But as the risk goes up to suddenly things like assisting in identifying a complicated diagnosis, we knew we had to have some way of safeguarding our client data while still allowing staff to access this pretty incredible technology. And moreover, because both the access to AI for general use has become so readily available, and also that the technology is continuing to evolve daily, we knew the need for a policy creation was immediate, but it was also going to be complicated. Our IT infrastructure, like many of yours, is managed at a county level. And so we started by reaching out to our county IT to see if they had already had an AI policy or if one was in the works. It wasn't. Then we reached out to some of our local nearby health departments and within our Michigan local health department networks to see if anybody had developed a policy. They hadn't, but they were interested in learning more if we found someone who had. So we really didn't know where to start, and we didn't feel knowledgeable enough in AI technology to build a policy ourselves from ground zero, which circled us back to the experts that we met at NACHO 360 from F&T Labs. So we were able to work with Naboo. We assembled a team of decision makers and enthusiastic AI adopters to determine what was most important to us. And we determined that for us, that meant staff education and data security. Another huge advantage to working with F&T was that they were all from the public health sector. So they understood the constraints in budget and time and the requisition requirements, and were able to work with us to meet all of those constraints. And finally, they took the time to review the policies we already had to ensure that we were identifying those that would touch on adjacent topics. So things like information security, HIPAA, acceptable use policies. And Naboo was also able to use those policies as a template. So this new policy was ready to be published immediately, which sounds like a small thing, but it meant it was another step that I didn't have to complete before we could adopt it. And that's a great thing, because that's part of the problem is we don't have enough time already, and adding these extra steps in is difficult. So it was such an easy process for us that netted a pretty substantial deliverable. And we are finalizing the adoption of it next week and figuring out the true nuts and bolts of what it looks like to implement with our team. So now that we have a policy written, it's also opened us up the opportunity for us to think bigger and consider how we can leverage AI to do some of those tasks that a computer can do, so our staff can focus their time on those tasks that a computer can't. So we're so grateful that we were able to lean on the expertise of the F&T Labs team to write the policy, but also for the responsiveness to our questions about the next steps, like educational materials and ensuring the AI tools we're using are as secure as we can make them. Your staff are absolutely using AI tools, whether you realize it or not. So this is a chance for us to be proactive. I encourage you to develop a policy to provide them with clear guidelines of use that protect them, your organization, and the individuals that you serve. So Nabu and Juliana, thanks for the opportunity to share our journey.
Thanks, Kim. That was very kind. So I know we're slightly running out of time, but to recap, does the policy identify what types of applications that can be used? Kim, I don't think yours does because we chose not to identify it, but yes, that is part of our intake process, Jonathan. And Kim, feel free to.
For ours, it's really that the person in my role or the county will identify a list is what's specifically in the policy. We didn't outline specific applications that could be used.
Jonathan, but there are health departments that do exactly that. So to recap, like Kim said, it is very likely that your team is already using AI. And given the workforce and technology landscape of public health, AI is actually probably a very powerful tool that we should take advantage of in the interest of taking our workforce's capacity further and maximizing the way that we engage with our community. That being said, though, an AI policy is absolutely necessary given the negative outcomes that it can have in order to minimize the liability of your organization and really empower your staff in a way that sets and manages expectations. And I do want to, I imagine if you should you choose to work with us, we'd love to do that. And everyone wants to know about cost. What we think is for most health departments, we can do this at or below the $5,000 range. If for some reason that is above your procurement threshold, we don't feel the need to go to RFP. We just want to help you all. If that is for some reason above your procurement threshold, let us know. We can try and pull some levers to minimize the cost for you. The other part of it is should you want to go beyond this and do an education series or demos of potential use cases, we can help you out there as well. With that, thank you so much. Thank you all so much for your time. And now we're happy to stay on as long as you'd like, and would love to hear from you and answer any questions and honestly create a space for an open discussion on how y'all are using these tools.
Yeah, so we invite you, if you want to, you can type questions in the chat. I think that we've had some really good, really good questions. You should be able to come off mic if you want to be able to actually sort of have that back and forth. But really appreciate everyone coming today and asking these questions.
Sean, I think, has a question, Juliana.
Oh, yes. I think so, Thomas, or Sean, if you want, you should be able to come off mute if you want to ask it, and then we'll go to Thomas.
Yeah, I think one of the things that we kind of like talked about is how like county and state IT departments are serving as gatekeepers. Well, one thing I literally was just informed about like yesterday is like our senior clinical leaders are also just like completely in the blank, like in the wilderness when it comes to understanding what this AI thing is. And Juliana, to your point, like they're like, oh, you're seeing like statistics of like 70% of county officials or staff using AI, but I actually don't think that level is that high if you were to like to survey like the local health officials network, like all the state health officers or the county health officers or that. Like I don't think that those folks are using these tools whatsoever. And like I was literally asked to brief a very senior official within the Commonwealth of Virginia, like what is a large language model, right? And like this is technology that's been in the zeitgeist for the last for over a year now. So what I'd like to, I guess my comment is we've got healthcare leaders, not just IT leaders, that are like slow playing this from just a pure lack of knowledge. And I wanted to know kind of like what is the strategy for like identifying the lowest hanging fruit? Like for me, it's like, can we use AI to just speed up how quickly we respond to insurance claim denials so we can get a couple more dollars in the door? Because it's like the easiest thing that our health division folks can lead. But if there's like other like super low hanging fruit that we can like, I don't know, seed the ground with so that they don't come back with an automatic, this scares me posture.
So I can take that, and then Nabu, if you want to jump in. So I think one, unfortunately, the burden becomes on you of understanding the landscape of what other organizations are doing, right? Nobody wants to be the first adopter of something that's like as scary as AI. And so being able to demonstrate what has been done in other places, I think can help without you necessarily having to build out a use case. So I think that is one step, because I think that actually healthcare is one of the places where I'm seeing some of the first some of the greatest adoption of AI, like in a clinic and a hospital setting in terms of decision support, as well as, I mean, when I take my kids to the pediatrician wears a microphone thing, and then, it writes her notes for her, which saves her a ton of time and then actually makes her a far better clinician, because she's then interacting with my 2-year-old who is running around bare naked because she doesn't want to get her shots. So I think that being able to show what others have done is one first step. But Nabu, I don't know if you have something else to add there.
Yeah, Sean, thank you for that question. And healthcare is notoriously behind or skittish when it comes to innovation always. But what we have done is two things. Is anytime someone asks us about AI, we ask them, like, what is the part of your job that you hate? Like, and then map out that workflow and then find the points where AI can help. So in public health, it's usually handwritten forms and data entry. And because A, we can't hire for that, and B, it takes too long. And so that's a perfect use case, because it's safe, it's closed loop, it just exponentially save time. With healthcare, I imagine probably doctors hate computer point and clicks. Like I worked in EHR implementation forever, and it was like, can you reduce the number of clicks? And I think that could be an avenue, but this is an uphill battle that we've fought forever. Sean, I know you personally, and like I know you do this every day. But the best answer I have for you is that, like, we try to address whatever audience is in front of us, their pain points. And I do think AI probably has an answer to help in the most mundane ways, but those mundane ways are exactly where it should be helping.
Thomas, yeah, if you want to ask your question.
Yeah, I was going to say mine's probably not all that different. And I sounds like we're not necessarily trying to do a laundry list, but I was curious about some of the other ways. I mean, you mentioned, Juliana, you gave some great examples of use cases. What are some other use cases that you're seeing in public health or healthcare?
Yeah, do you want to take that?
Sure. So we talked about forms. We are starting around ECR stuff. There's a lot of EPIs are using it as if you have a chatbot, you can run your code by it, and really increases the amount of time, or decreases the amount of time it takes to analyze data, because you're essentially coding with a buddy. It doesn't do well with SAS, but it does really well with R and Python. The other application, one of the ones that we're working on, is with emergency planners, where you can help you can feed it standards. So whatever your emergency plan FEP standard, or whatever FEP standard is, you can feed it that and have it used to identify gaps in your plan. And we haven't built this yet, but we're working toward it. Like, you could use it to be like a Jarvis, if you know Iron Man, for you, where you can say, I have blank emergency, and how do I evacuate something, or how do I call the MRC? And it can do that pretty quickly in a conversational manner. And that's especially true for onboarding new staff in the middle of an emergency. One of our clients, where he wants to go, is to take GIS data and put it on top of that, so that it can like give you a path and stuff like that. So we haven't built that out yet, but that's where that's going. The other very, very mundane use case in a health department is people will create chatbots that have your procurement and HR process manuals. And so, I imagine this is, if someone's like, I want to go buy a widget, you have to go send 1,000 emails to 1,000 people. But if you had a chatbot where you could ask procurement questions or AHR questions, that significantly reduces the amount of time. So those are the kind of use cases that we've seen. If anyone on the line wants to share, Kim, or please go for it.
I was going to say, if you didn't mind me jumping in, kind of our next process or project that we're working on with Nabu that our teams are really interested in is developing chatbots that are using specific resources only. A good example of that is our food team having the food code built in, so that they can just ask in common language questions without having to read the whole food code, or like try to figure out specifically what pieces are going to touch whatever their question might be. The same thing with our MIHP team. They are not very tech savvy. However, they are spending a lot of time trying to search through their guides to find answers to kind of intricate questions, and being able to have a chatbot that you can common language ask a question and have it use just those resources. Because obviously we don't want people's opinion from the internet. We want very specifically from those resources. That's one of the things we're really excited to start using.
Thanks, Kim.
Great. That's really helpful. Has anyone brought up the scenario? And so I find myself in a couple of different worlds, including the education world. And we have a couple of partners in the state who have talked about app-based for, just chatbots basically, but for young people potentially screening for mental health challenges. Have you heard about this? Like these very deep-seated concerns well up in me over something like this, but curious if you've heard any of that or any thoughts or responses around that.
So I have heard of them, and again, I don't know if I would our company definitely wouldn't recommend that for a public health department, let's say. But this tool is very nascent. It's new. Use it for the parts of your job that you hate, right? It's not, can it be used to screen for mental health? Absolutely. Are we there yet? I don't know if we would say yes now. That may change. There's a lot of people using AI for therapy. Like that's gotta be, you just can't monitor where
that's gotta be problematic, right?
Yeah.
Well, and then okay, so I'm gonna say this one other thing and then I'll stop. But there is a plan, or there is a app for Alcoholics Anonymous. And so part of me gets it, but anecdotally, I heard that in one of the pop-ups on the screen was how to be, a bartending app as well, like a chatbot. So, that's really problematic. Anyways, so I'll stop.
Absolutely. Again, we have to be very careful with these tools. Just the bottom line.
Yeah, you have to think about them. I will say, as a kid in the early 2000s who used AOL Instant Messenger and talked to some robots that were not AI and just sort of had canned responses, I did benefit from just having this chatbot that it was awful. And but there were ways that I felt at times like I could say something to this chatbot that I couldn't to a parent. But this is where you actually need to think about what are the risks, what are the rewards, and how is this holistically impacting health, as opposed to just rubber stamping and saying that we don't have enough mental health professionals, so yes, we're going to stamp this and approve it. But you also don't necessarily want to just throw the baby out with the bathwater, which I'm not saying that that's what you're doing. AI tools just require evaluation, thinking about your values, your morals, and also being willing to reevaluate and say, hey, actually, we think that this has gone too far and this isn't a great thing. And since we're having a policy is actually really helpful, because you can revise your policy and say, actually, we think that, we said that AI for mental health was okay, and now we're actually going to take that step back.
Thanks, Thomas. So Jonathan, yeah, you're so welcome. Thank you for that. Jonathan, so if I'm reading your question correctly, you're asking if there's any practical use case for daily operations versus public health specific ones. And yes, 100%. So the most common thing we see is people using it for meeting notes, and that's like straight out of Teams or Otter AI, or Zoom, I think has its own AI meeting transcription now, and just voice to text in general. The things around that, make sure you get consent, make sure there's a process to do that in every meeting, and then what happens with those meeting notes is important. And that also some state law might apply there. The other thing is this idea of applying AI to create like HR or procurement chatbots that can be the first line of defense with policy things. So like I think there's an easy use case to be made for, I want to apply, like not I have COVID, what should I do? That should probably be a person, but I want to open a restaurant, what should I do? Giving like you could easily upload your food code and your permitting process to an AI engine, have a thing for your community if you'd like. But really at this point, it's about like meeting transcriptions, scanning paper forms, using it for your personal workflows. Those are the easiest use cases to evaluate right now.
Yeah, and I would say, there's so much potential for the personal workflows, right? The helping rewrite the tone in an email, helping write a report, that those are super, super important workflows, and figuring out how do you want to leverage AI in a way that you can control to allow those to be done. Like, right, we shouldn't discount the power of those as you think about the workflows within your health department.
Melissa, thank you for that. Please set up some time with me if you'd like, and if not, I'll once we've built it and once we're in a further space, I'd love to show you what we're working with, and we're happy to introduce you to our client as well, who's working on that. Kimberly, there's a question in the chat for you. You're welcome to answer it or in the chat or come off mute.
I was gonna say that's a big piece of our policy, is that at this point there are staff using even just their own personal ChatGPT accounts, things like that. A big piece of our policy is creating a whitelist of tools that they can use, but also implementing first the education and requiring training before using these. Primarily are any kind of software requisitions that team members want go through their managers. It's all kind of paid by team. So we are willing to take on those costs for our staff. However, they have to go through our training process before they can start using them.
Thanks, Kim.
And I think Tim pointed out something, about chat support for food safety, and that they weren't able to figure out the human in the middle. In work that we've done, we have incorporated that human in the middle, where we think that is the key thing, is not just letting AI run amok, write all of your emails, do your case investigations, start, robocalling people of, however you would do that. So at least for us, with the tools that we've built, we've been able to build that human in the middle. And we think that is really crucial, not just from like a liability standpoint, but also just like from an ethics. And we think that the people part still matters. This has been a really wonderful, lively discussion. Does anyone else have any questions? Okay. Well, I just am thankful for everyone taking time on their Friday. I hope that you all have just a fantastic weekend, that you're able to enjoy the fall vibes as a lover of fall, and the leaves are changing here in Northern Illinois. But I hope that you've walked away from today with a sort of sense of why an AI policy is important, as well as a few things to consider when writing that AI policy. Thank you so much to Kim for joining us today, and thank you all just so much for joining and for participating in the discussion. I hope you all have a really, really great weekend.